Podcasting is a lot like riding a bicycle. It's just a lot harder to put baseball cards in the spokes. Mac Engel, Fort Worth Star-Telegram, Engel Podcast. I am back after a little bit of a break, summer vacation, hiatus, sabbatical, pick your word, maybe a mental health day. I am back just in time for the start of football, basketball, hockey, soccer, school year, absolutely bat-ass crazy political talk with the presidential election coming in 2 months or so. I will not be participating in that talk. However, for this episode, I'm going to go down a rabbit hole that is a subject that usually drives people crazy in one or the other direction. Talking about abortion. Awkward silence, please. Abortion became obviously a federal law in terms of it being allowed back in 1973 under Roe v. Wade. In 2022, the Supreme Court overturned that decision and returned it to the states. Now, for the record, I am pro-choice. Now, there's some specifics in there, how I would prefer it to be allowed, but I am pro-choice. And I got there because when I was a kid, I was about 14 or 15 years old, and someone very close to me had one, and I sort of unintentionally made the decision then that I would never condemn her for doing it because she was quite young, and I saw what it did to her and the decisions and the specifics that went into her doing that. And I was never going to condemn her for doing it. Years and years later, I talked to my mother, and my mother is in her mid-80s and a staunch conservative. And she's pro-choice. Doesn't really add up, does it? Because she lived through a time when women in this country weren't even close to equal. If it's here today, well, it was here when she was a kid. It was way before Title IX and all these other legislative measures that have put in place to give women a shot to be on the same plane as male. So when it comes to this issue, she's very much on the side of what a liberal would be. She found out she was pregnant with me in 1972. She told my dad, I know I'm pregnant. And my dad said, we have choices. Now, Roe v. Wade had not been law yet. They had not allowed abortions to be legal yet. But anybody can understand what my dad was saying, to which my mom said, no, we don't. I am the youngest of 6 children. There are 5 of us who are left. We lost my oldest brother a couple of years ago. But at the time, my mom was pregnant with her 6th. And there is a 5.5-year gap between myself and my next oldest sibling. So anybody could understand after 5.5 years of being out of diapers and all that other stuff, you would say, well, I don't know if I really want this. They went ahead and did it, much to my delight. But my mom, however, very much remains on the side of women who want the right to choose. And again, she's a staunch conservative to the point where it does not matter who the candidate is. If there's an R next to their name, she's going with that person. And if she's on the other side of this issue from the traditional conservative, then I very much support that as well. That's my feeling. I understand those who disagree with me. To shed some light on this topic is a woman who is an expert on this subject. She is Dr. Andrea Palmer. She has spoken on women's health care. She's pardon me, let me back this up. She's a gynecologist in Fort Worth, Texas. She has been for several years. She's a friend, someone I trust, and is a tremendous person and professional and is an expert on this topic. And she can give you some idea of where we are on this debate today. Please welcome my friend, Dr. Andrea Palmer. Did you see this coming where we are now in terms of the abortion debate and where we are in terms of what's available and specifically not available?
Yeah, I think
Did you really?
yeah, the writing has been on the wall. I think that anybody kind of in tune to reproductive access, the day Ruth Bader Ginsburg died, we all died inside right along with her, knowing that. And then when they would like, yes, it's been, I mean, the anti-abortion movement has been uh, aggressively working for years to,
Decades.
yeah, to get us where we are today. And so I think we all saw it coming.
So if you saw it coming, and for those of you in your profession knew that it was coming, was anything done or could anything have been done when you look back with hindsight and said, boy, we should have done A, B, C, D through Z to try to put ourselves in a better position so something like this couldn't happen?
I mean, I think as a group of physicians,
Yeah.
no.
No.
I mean, I think as a country, if we had codified, abortion access into law, that would have been um, the wise thing to do to make sure that, the whims of a Supreme Court aren't going to uh, just disrupt healthcare for, half of our population.
So if you saw it coming and then the decision came down to effectively reverse it, I know they made it a
Mhm.
states' rights issue, but it effectively reversed it. Has it played out the way you feared? Better, worse?
The way we feared, I think, is probably pretty, um, I mean, for those of us who know about the reasons that abortions happen, I think it's played out exactly as we thought. I have been, I, I truly don't think in the heart of all their hearts that these anti-abortion advocates were, that their goal was to interfere in cases like preterm premature rupture of membranes. I don't think their goal inherently was to interfere in like medically indicated terminations of pregnancy. I think their goal was to stop elective terminations of pregnancy. But medicine is so gray, it is not black and white. And the difference between elective and medically indicated is it's not clear cut. And so I think there's a little bit of the fact that like the dog caught the car. And if you listened to when the Supreme Court was hearing the EMTALA case, which so the Biden administration has sued the state of Ohio
Mhm.
because their abortion ban violates EMTALA, which is the Emergency Medical Treatment of Laboring Patients Act. Um, or something along those lines, basically saying that an emergency room can't turn a patient away because they don't have insurance, because they can't pay, because their doctor's not there, specifically if they're in labor. And what's kind of ironic is that this law, EMTALA, was spearheaded by facilities here in Texas. Parkland Hospital over in Dallas was like a main player in getting EMTALA to be the law of the land because as like the county hospital, private hospitals would turn away patients who didn't have insurance, uh, and put them in an ambulance and send them to Parkland. And so they would show up on their doorstep as just complete medical disasters that should have been addressed, at the original institution. And so when the the attorneys were arguing in this case, Amy Coney Barrett, who is staunchly anti-abortion,
Very.
was shocked. The transcript I listened to, she was like, I can't believe this is happening. You can't? You can't believe this
Right.
is happening? What did you think was going to happen? And so I think that a little bit is that people making these laws don't know
Right.
about medicine. They don't know about they don't know about healthcare. They don't know about pregnancy care. And so we have people making the rules who have absolutely zero idea about their implications.
So your field of study, your practice as an OB-GYN, what I know about it, its history, part of it back in the 1800s was for lack of a better word, some of it was barbaric.
Oh,
My
absolutely.
okay.
Yeah.
So at what point did or how did the moral priority in this discussion, in this debate, supersede the preferences and the well-being of the patient? Because it seems to me, when it comes to this, and tell me if I'm wrong, the moral judgment in this is winning out. Am I wrong?
You are absolutely correct. Um, and
How does a professional negotiate that?
and I think it ties directly back to the history of obstetrics and gynecology, like you mentioned. Women back in the day when they were, perfecting surgical techniques and things like that. I mean, if you go look at our history, they would operate on women of color
Yeah.
without anesthesia, thinking they couldn't feel pain. Women have never had agency over their body, ever. And it started then and it's continued now, and it might look different or it might seem like at some points that we did, but all of medicine, and I do think it's shifting, but there's a paternalism to medicine and I think it's shifting as more women become physicians.
Mhm.
Um, studies are coming out all the time now that women surgeons have less complications, that their patients are readmitted to the hospital less, like outcomes are better when women get taken care of by women, because I think there's more acknowledgement of their experience. I think that there is more, um, like, you don't know how many women I see, young women or even women who are old now, old meaning, my age,
Right. I was just going
old,
to ask you for
old
this.
meaning mid 40s,
Right. What are those
who,
parameters?
um, you know, since we have no access to abortion in Texas, the number of women coming in asking for a sterilization has skyrocketed.
Really?
And I get, under 25-year-old women at my clinic at least once a week asking, who have not had kids,
Right.
asking for sterilization, permanent sterilization. And so many women who I talked to in their 40s said, I asked my doctor back in my 20s. I never wanted to have kids. I asked my doctor back in my 20s if they would tie my tubes, and they said no, because I might meet somebody and they would change my mind. And so you think about, if a 21-year-old walked in my clinic pregnant, I certainly wouldn't tell her that she's not capable of raising a kid, right? So why am I going to tell a 21-year-old that she's not capable of making the decision to not raise a kid? But there has been this vibe of like, we know best, we know what's best for you in medicine, and especially in obstetrics and gynecology, again, for decades.
So the part that, and again, I'm going to ask you again, because
Mhm.
you answered a question that I
Sorry,
was
I
going to
got
ask. No,
I squirreled.
it's the part where I just didn't get where the morality, which
Oh, yes,
in my view is mostly Christian based, right? Because
right.
that's what we were founded, where the morality of this became the priority over the patient's health,
Right.
well-being, and decision,
Yeah. So
and
they're prioritizing
their
fetal,
faith, their faith.
right? Yes.
To my mind, tell me if I'm wrong. In my mind, they're prioritizing their faith and how they interpret the good book.
I think that faith is a nice hook to hang this hat on.
Oh, okay. Do
Um,
you think it's bullshit?
I think it's about power. I think it's
Okay.
about control. I think that devaluing women is at the basis of it, because
They
the
don't.
in a pregnant person, the fetus has value greater than the woman to anybody who is anti-abortion. So you're prioritizing this unborn life
Okay.
over the health, wishes, and well-being of a fully formed, functional human being who may already be a mother, who has obligations in this world, who helps people in their day-to-day job. And you're prioritizing this person who is not yet a fully formed human over them. So women just don't matter.
So, but because you alluded to it, we can see it anecdotally, and I'm sure statistically it backs it up. There are more female doctors now than ever before, and then more female OB-GYNs than ever before. And I'm going to guess, I'll bet all of my money, Andrea, that a lot of those professionals are on the side of the morality over um, the wishes of the patient. Am I wrong?
I would say that if you polled OBGYNs,
Yeah,
that 85% or more would be pro-abortion.
would be pro what?
Pro-abortion. They would be
Pro-abortion. Okay,
pro-choice. Yeah.
pro-choice. Okay.
Yeah.
So for the remaining 15,
Hmm.
and you live in a very conservative state, you grew up in
Do you?
Oklahoma, pretty
Yeah.
conservative. For those remaining 15%, since we're talking about a small number, and a small number obviously dictates a lot of policy in this country and everywhere else too.
Hmm.
But for those 15%, how do you have this discussion? How do they? I want to get the rationality of it. I can sit back
Yeah.
and say, okay, that's your point of view, and I get it. But
Yeah.
how do they rationalize that?
I don't know. I mean, I think they,
Okay.
I truly don't. And I
Okay.
think they use their faith as a rationale, and that taking of a life is murder. And, but I don't know how they square in their minds prioritizing one life over another.
So you have been, I don't want to say outspoken, but candid with your views about this topic. Really, I don't know, I think I've known you 14 or 15 years, really, since I've met you. And, considering where you live and how conservative it is, has it ever cost you?
Um, so I'll knock on wood first.
Yeah.
Um, and say, maybe not that I'm like inherently aware of. When I kind of got the first opportunity to go speak publicly about this, um, Blake and I had a long discussion about like, are people gonna knock on our door? Are people gonna harass our kids? Are they gonna pick it outside my office? I mean, it's a very quick Google search to find out where somebody lives and works these days. And so,
Right.
we certainly, I went into that first very like public discussion about this with the knowledge that um, those kind of things could happen. But I feel like it's a substantial enough issue that it's one of those things I don't feel like I can not say something about. And the vast majority of my advocacy around this has been for these women who have really medically indicated cases for abortion.
But you just
Uh,
said, and I'm not, that the medical part of it can be gray.
mhm.
And if it's gray, could the doctor theoretically come up with any number of reasons to justify?
Oh, absolutely. Because here's the thing, pregnancy is dangerous,
Right.
right?
Yeah.
If a woman is pregnant, they have a higher chance of dying in that 40 weeks than they do if they're not. So one could argue, just facetiously, that any pregnancy is a risk to the mother's life.
Okay.
And so again, it's a gray area as far as if somebody is a very uncontrolled diabetic, is that pregnancy is inherently far more risky for her. But is uncontrolled diabetes a reason to terminate pregnancy? Most people would say probably not, but some people would say potentially so. Hypertension is the same way. Somebody with, very uncontrolled blood pressures, pregnancy is going to put them at incredible risk for stroke, heart attack, seizure, all of these things that we know are complications of high blood pressure in pregnancy. But just the presence of high blood pressure at the beginning of pregnancy is not inherently like a reason to terminate a pregnancy. I think the most tragic one, like tragic aspect of the medically indicated abortion argument is the women who have fetuses that we know will not survive.
Mhm.
Babies forming without kidneys, babies forming without brains, babies forming with anomalies that are just not going to be able to survive outside of the uterus. And making those women carry to term with all of the risk that entails is, in my mind, criminal. But then you get to gray area there too, because you think of things like trisomy 18 or trisomy 13, which are conditions that um, kid has an extra copy of a chromosome. So the one that we know kind of more commonly is Down syndrome, which is an
Mhm.
extra copy of the 21st chromosome. So these are like that, but a different chromosome number is tripled. Those kiddos, by and large, are not seen to be compatible with life. But if you go Googling, you're going to see kids with trisomy 18 and 13. Now, do they get on the school bus and go to school? Absolutely not. They are vent dependent, peg, like, feed through a tube, not communicative kiddos, but they are technically alive. And
Yeah.
so I think in those situations, you could even have people push back and say, well, this baby lived. And so you have to try. Um, and I think that, again, and the Texas Medical Board has been meeting and it's getting ready to hold public comment on um, people to come and give their opinion on like what should be exceptions or if they should make exceptions to the rules. And I think this is the problem we're going to get into. This is so nuanced that you cannot possibly outline every single exception that needs to be made because arguments can be made on so many sides of it.
If a woman in Texas and in states similar to Texas, if a woman is, say, 3.5, 4 months pregnant, and she wants to make the decision to abort,
Hmm.
and she has the money, this is
Hmm.
a big distinguishing factor.
Right,
She has the money. I always
right.
love it when people say, well, she has resources because she has money.
Yeah,
So she has the money to do it.
yeah.
What's her option?
Um, New Mexico,
Okay.
Chicago, Denver, those are our closest um, clinics who offer second trimester terminations.
Take the same woman. Now she doesn't have any money and she doesn't really have that much support, and she wants to abort. What are her options?
She has no legal option in the state of Texas, and so she has to carry her pregnancy.
Have we seen a birth rate spike in the couple of years since this decision was rendered?
We have, and the statistic that's coming to my mind is an extra 10,000 births per year. But I don't quote me on that one, but
Okay.
I think that's right.
When do you see this? I've predicted for a while since this happened that ultimately it would be reversed again. I don't know if it'll be in my lifetime. Obviously, the court's going to have to change, but I
Yeah.
predict that eventually it will change when certain justices retire or
Mhm.
die, one or the other. How do you see that playing out, Andrea?
Yeah, it's going to take yeah, I mean the two options are to codify it legislatively or
Yeah.
to get the court to change their mind. And that will definitely take, the right justice leaving the court at the right time. If we have another justice leave, no matter their affiliation during a Republican presidency, it is likely that this will not change anytime soon. Um, I think, frankly, our best hope is to try to legislatively make it happen. But I don't know if that's a thing that will ever be able to get done.
I heard a colleague of yours say one time that she had quite a few patients who are Republicans in Texas, but will be Democrats in California. You know this person. Is that a common thing?
I think that I mean if we had to divide ourselves into Republican and Democratic parts,
Yeah,
I mean, frankly, most of us would be Republicans when it comes to our pocketbook. Like I would
sure.
love to pay less taxes. Who wouldn't,
Yeah,
right?
yeah, I'm with you.
Um, I think that I think that socially more people lean socially liberal than lean socially conservative when you think about things like gay marriage, when you think about abortion rights. Um, and I think there's a big chunk of people who really don't care
Yeah, I think you're right.
because they don't think it applies to them.
Do they not think it applies to them, or do you think those situations are so foreign to them because they've never been exposed to it personally.
And maybe some of both.
Mhm.
Um, I talk to women who are older who are like, well, I don't need to worry about abortion. I'm in menopause. I don't have a uterus. My tubes are tied. Um, but I think that we've lost a substantial amount of empathy in this country for our fellow humans. No, abortion doesn't matter to me. I don't have a uterus anymore.
Right. Yep.
But
What do I
does it,
care?
right? Yeah. So I'm fine. I'll make sure my kid is always on contraception.
Right.
I have boys. Like whatever it is. But you have to, I mean, if we think about our neighbor, if we think about the person who checks us out at Target, if we think about, then abortion has to matter. If we think outside of our own little tiny home, that abortion has to matter because, but it, if you, and I don't want to put words in her mouth, but Kate Cox is a woman from Texas who had a very kind of public fight to get an abortion. And she has very plainly said that she was anti-abortion before this happened. That she never thought she would get an abortion. She never
Yeah.
thought she would need an abortion. She never thought that, anybody in her family would need abortion care. But people assign this morality to healthcare when it comes to reproductive care that we don't give to anything else. We don't legislate who can have stents in their heart if they have a heart attack from eating too much McDonald's. We don't legislate that smokers can't get care for their lung cancer because they smoked, even though knowing that was going to increase their risk. Like we assign no moral judgment to any other aspect of medicine. It is only to reproductive care.
California Governor Gavin Newsom, who is probably not very popular in Texas, has said, he's not the only one who said this comment, but he came
Uh-huh.
to mind, that if men could get pregnant, abortion would be legal
On
at
every street corner.
absolutely.
Yeah.
I think I know the answer to this. Do you agree or disagree?
I wholeheartedly agree.
So do I. He's 100% right.
Uh,
But you brought, and this is something that I've thought about for a while. Um, the people making this decision usually are men, and they have been for a long, long, long time.
yeah.
And they obviously, because biologically we're not capable, can't empathize with that experience of carrying a child. Obviously, just can't. Um, I'm of the mind that until you get more people in positions of power who can empathize with a certain sector of society, then those laws are not going to be drafted in a compassionate manner. So, all that being said, where does the father, the man, belong in this debate? Debate's the wrong word. Discussion.
Yeah. Um,
Ideally, ideally.
yeah. I mean, I think that opinions can be rendered, but it's inherently not their body that's on the chopping block. They're
Hmm.
not the one that could end up with seizures, strokes, hemorrhage, surgery, blood transfusions, urinary incontinence, pelvic floor prolapse, stretch marks, like postpartum depression. The amount of things that happens to a woman's body during pregnancy, it is astounding. They are growing a human being from scratch inside their own body. Their feet change shape. Their pelvic bones separate. Their pubic bone pulls into two. And until that is happening in your body, I don't know that you get an opinion about it happening in mine.
What about the potential? What about the father? Do they have a vote? No, a vote, but a voice.
I mean, I think there's room for the discussion,
Oh,
but I think,
I'm talking about
oh,
on an individual level.
I mean,
No,
on an individual level,
yeah.
sure.
Right.
Of course it would not be her decision and her decision only. Like that's something that you do with your partner. Do I think that somebody not in a committed relationship gets to decide what a young woman with an unintended pregnancy does with her body? I mean, if they're going to sign up for 50-50 childcare, sure, maybe, but the chances of that happening, slim to none. So unless you're going to guarantee to be around to, again, negating any risk to the mom's health, you're talking about the rest of her life. And so the repercussions for a young man getting a young woman pregnant are essentially zero, right? They might be able to come after them for child support, but if a 17-year-old girl gets pregnant, her chances of going to college, her chances of getting an advanced degree, her chances of um, landing a job with, 6 figures in it decreases substantially. His chances, they don't change at all.
Fine.
They don't change at all.
So one of the arguments, one of the counters to this I always hear is put him up for adoption. Right.
Right. But
Put
then
him up
that
for adoption.
complete,
Well, hang
yeah,
on, because
yeah,
I want you to, I need you to crush this one, because this is
yeah.
a part of the debate that I hate. The person making that argument has absolutely no clue what the adoption or foster care system actually looks like.
Right. And are they going to adopt that baby?
No.
No, no, they're not. And there are plenty of couples out there and women out there and families out there and men out there who might want to adopt a baby, but that process is complicated at best.
And awful and potentially expensive and maybe
Yes.
even emotionally traumatic.
Right.
Yes,
Again, regardless of the physical impacts of pregnancy that woman has to undergo just to give somebody else a baby against her wishes.
give me, last thing I'd ask you and let you go. Give me the one anecdote story that you have seen or maybe even experienced or handled since this decision was that came down, that people should know about and in a way broke your heart. Do you have any of those?
Got lots of those.
Wasn't
Can I?
expecting that.
Yeah. I'm going to start, I'll give you two,
Okay.
but I'm going to start with one that actually happened before SB 8 and before the laws changed in our state. This was a patient whom was in her early 40s, and she was diabetic, type 1 diabetic, and had high blood pressure and had a gastric bypass. So 3 comorbid conditions for
Oh,
pregnancy at baseline. I took care of her during her first pregnancy. She actually did pretty stinking fantastic. Had, a few complications, but everybody healthy and happy at the end of the day. She then had a miscarriage we did chromosomes, and it was a trisomy 18 or 13. I don't remember which one. She then got pregnant again. And mind you, she's getting spontaneously pregnant, which is just a miracle in and of itself
wow.
with her age and her health issues. Her third pregnancy, baby had no kidneys. At this point, she is 42 years old with all of her medical conditions.
Does she want to have a baby?
Yes, desperately.
Okay.
Yes, desperately trying to have another kid.
Okay.
So they want to give her son a sibling. So had a miscarriage, had this baby with no kidneys. Of course, that wasn't diagnosed until about 17 weeks because that's early, and she had her anatomy ultrasound at 17 weeks, and that's not something that shows up genetically because the kid's genetics are normal. So she was able to terminate her pregnancy in state, went on to get pregnant again, had a kiddo with Down syndrome, healthy, happy. I saw her a few weeks ago for her annual exam. I got to see videos. I got to see pictures. Like, they have now the family of their dreams. Had she been made to carry that kid with no kidneys to term, it is incredibly likely that she would not have been able to get pregnant again just based off of her age, right? Age alone. When you hit 43 and then 44, your fertility rates plummet. And so she is an example of why abortion care matters.
Okay.
I mean, do you want to hear the story about the woman who got drugged and raped? Do you want to hear the story about the baby whose brain was developing outside of its skull? Do you want to hear the story about a young woman, 18-year-old, who had a baby with trisomy 18? I've got, and that was just all for the last, lots.
And that was in the last however long? Or how long were you going to say?
That was in like a 1-year time span.
And they all carried. to term?
Yeah.
Do you have any idea how they're doing now?
I've one of them has had a healthy kiddo since then. Actually, two of them have actually.
Oh, no, no,
And
no. I'm not talking about since then. I'm talking about in regards to those deliveries.
how
How are the mothers, how are the families doing? How are the mothers doing?
um one of them had the means to travel and chose to not,
Okay.
which is a luxury.
Yep.
You know, she just she it was just her choice to not. The other one of the trisomy 18 kiddo was literally the week after SB8 passed. And she was like, I didn't know this would apply to me. I thought that just meant people who didn't want to have babies. But this was a very wanted pregnancy, and she didn't realize the law was going to apply to her. Um,
And I could probably talk to you about this all day, but I know you have a job and a life. Uh, thank you very much for your time today. I always
yeah.
love talking to you. Thank you very much. I
Yeah,
appreciate it,
you're
Andrew.
welcome.
All
Yeah,
right.
good to talk to you.
Okay.